I'm Lyndsey Tran. I'm the coordinator for the Worthing Dementia Action Alliance. I've been running the pop-up dementia hubs alongside my role in the community. My intention originally was to find a way to connect with the local public, to make sure people are aware of their community being dementia friendly and what was needed to establish that further. As the hubs went along, we were finding more people were coming to us worried about their memory, where to get support in a timely manner. So they may have been diagnosed 3 years, but their needs had changed, especially for carers who are aware that they may not start to need some more help and support. So we needed to look at a way that we could still deliver the hubs and be very clear on what we were offering to the public and to people that were accessing the hubs. We made sure the information we had at the hubs was very localised, so there was no point giving people information that was across the other side of East Sussex that they probably won't be able to access or were unlikely to at any point. So it's very much what was going on locally. With my role as the coordinator for the Alliance, I was able to really gather an understanding of what information was available locally. So when I was running the hubs, I was giving timely advice that was current and able to look at what waiting lists were, so they had an idea of timings, things like that. Where we ran them was quite key. We looked at clinical settings, community settings, looked to churches, leisure centres, festivals, anywhere there was people, we could run a hub. What was really key for us and what our ultimate goal was to try and run these hubs outside of the normal Monday to Friday 9 till 5. We wanted to see them in earlier mornings, evenings and weekends to see if that changed the demographic of people that were visiting, if there was a gap, a need in what was already offered locally. We also were aware that we were seeing a lot of people with memory problems, a lot of carers. We wanted to see if we were opening up to maybe more professionals, businesses, care homes, the public, to get involved and find out more. There were a variety of challenges. Worthing wasn't one of them because Worthing is already an established dementia-friendly community. As part of my role as the coordinator, I'd already built up a lot of connections with different organisations to be able to run these hubs. As you can see from the figures, we ran across Worthing and Ada 46 Dementia Pop Up Hubs across different locations. We saw over 100 people across these hubs, which is huge. Majority of the people visiting were carers. As you can see on the chart that we've put 40% carers, we've got 24% member of the public, which does sound like quite a lot of the public have an interest in dementia when they're not necessarily connected to it. However, it was quite hard to differentiate situations where we'd have, say, a family member whose dad's got dementia, mum's caring for them, and they wouldn't see themselves as a carer. So they weren't coming along saying, I'm a carer for my mum and dad. They would just say, oh, dad's got dementia, and they wouldn't see themselves as a carer. So it was quite hard to where we sort of put them when you're doing a tick box exercise, really. Alongside with the 12% of people living with dementia, again, there was a percentage of them that when people who had memory problems, worried about their memory, mild cognitive impairment, who may not have a diagnosis, we still kept them under that bracket because they were looking at a service or a need for themselves rather than it being for their business, organisation or something like that. A lot of the information given was very generalised, occasionally specific, obviously form filling. I think one person needed some support with a form, a few people needing some benefits advice. Most people, when they get diagnosed, those are some of the key things they look at. You are able to get council tax reductions, you are able to get attendance allowance, things like that. However, we still saw a percentage of people that didn't have that, they didn't know, and even without a diagnosis of dementia, they could still access things like attendance allowance. What was a great benefit for us was the Dementia Friends. So we saw a few care homes, business organisations, and even carers who really could do with the education, that they weren't aware of the impact really of dementia. So from that, I booked around 40 different sessions across Worthing and Ada, creating over 600 Dementia Friends through doing our hubs. So it's huge. It really opened up, and I don't think I would have been able to deliver those without the basis of having the hubs there, and getting people coming along and finding out more. Some of the hubs we ran in the evenings at Worthing Hospital were really well attended, very busy. A lot of people who were looking to have the person they were caring for discharged wanted to make sure they had everything in place and wanted to know if there was anything else they should be thinking of before they came home. So that was a really worthwhile relationship we had with Worthing Hospital. We did quite a lot of different day events with them as well. The hubs did feed into lots of different things. As for the Dementia Friends, and linking in with other organisations was quite key. Working with the carers health team at a regular hub was great, really added value. And a lot of organisations could see that there was a lot of value in offering to a wider spectrum of people. I think if anyone wanted to look at running Dementia Pop Up Hubs, my advice would be make sure they look at what they're trying to offer. Because we went back and forth a few times about whether there's information we should be offering or shouldn't be offering. People are coming, should we be telling them about paid services? Or should we just be looking at the free services or choices? There was a lot of things back and forth we had to look at to make sure we were being fair and people were getting a wide range so they could make their own decisions. One of the interesting things I found was when you look at the difference between signposting and referring. So through signposting, we would be saying to people, I would recommend that you contact Carer Support West Sussex, Crossroads, Alzheimer's Society as such. Whereas with referral, it was us taking their details with their permission and signposting them directly. So actually emailing Carer Support West Sussex and saying, would you contact this person please? You can see there's quite a big difference. The amount of people that are willing to give their details compared to those that weren't, that were happy to go away and deal with it themselves. There was only a small percentage that were willing for us to do it for them. So I'd say that was one of the challenges we faced really, was that people visiting the hubs and that would be it. It's unlikely we would see them again or know how they were getting on, whether they'd had any benefit to it, whether the advice we were given had worked. Having our website was quite helpful because we could always say to people the information's up on the website, the dates will be back during the hubs. So we'd always make sure people took that information with them. It was like having a backup to the hub really, so they'd see us on a face-to-face. One of the questions we would always ask was, if we hadn't been here today, how would you have got this help, support and advice? Most would say GP surgery, which was quite interesting because a lot of their needs were social, not clinical at all. So to keep, getting GP appointments, we looked at one of the GP surgeries. Over one day we had 10 people visit. 2 of them, it was quite clear they needed a GP appointment there, that day if they could get it. So, but the other 8 actually didn't need the GP appointment. We were able to meet their needs there and then at the hub. And I think that was quite a good way to show the preventative of what these hubs were offering. We were trying to reach people before they had a clinical need really, that was looking at their social needs before it became something more.